My name is Michael Mohseni. I work here in the emergency department as a consultant at Mayo Clinic, but I've also had the opportunity to focus some of my research efforts on a study here called runner science. What runner science essentially is a study that looks at the effects of endurance running on the human body. Collects data, we've collected data on training variables, physiologic data, and also laboratory investigations over the course of the past 4 years to help us shed some light on the effects of running on the human body. The last 4 years we've had the opportunity to recruit over 2,000 runners in association with the Runner Science Research Project and the National Marathon to Finish Breast Cancer to learn more about the effects of running on the human body. One of the most surprising things that we've learned from our research to date is that there is actually a high rate of running-related injury, and that runners oftentimes come to races with having sustained an injury within the 30 days prior to running the marathon. Surprisingly, runners continue throughout their training and are able to complete the marathon or half marathon, but running-related injuries continue to occur at relatively high rates. Our research over the past 4 years has been funded by a grant that has now run out. However, we are now seeking and actively pursuing other funding possibilities. If we are able to pursue the runner science research for a 5th year, this coming year, 2012, we'd like to focus again primarily on running-related injuries, specifically looking at training profiles, types of training programs that runners may have used, types of terrain they may have run on, types of running patterns, and see how this relates to risk of developing running-related injuries during a race. The overall goal of runner science, and how this hits home personally with me as well, is to shed light on how to run smarter. We want to learn more about what tends to lead certain runners in certain situations towards developing injuries. And with the research that we've pursued to date, and which we hope to continue to pursue, we would like to help runners be able to run smarter and run with fewer running-related injuries. If you'd like to learn more about runner science or other research here at Mayo Clinic, feel free to visit our website.